So this is a very exciting presentation. We have 3 very exciting presentations. The first one will be Dr. Helen Herrman. Dr. Helen Herrman is a very renewed researcher in this area related to prevention and early detection of high-risk individuals. She's professor of psychiatry at Origin Youth Health Research Center in the Center for Youth Mental Health at the University of Melbourne. Her group has a very impressive production in this area, and this group is pioneer in this area, and we have a lot to learn with Dr. Herrman. I would like to thank for her presence here. I would like to thank for everybody here who have attended this symposium for us at the Unifesp. It's really a privilege to have everybody here. So, Dr. Herrman, please.
Well, thank you very much to our chairman for the kind introduction, and thank you to you and to Jayamari and to all colleagues here for the invitation to come and for a very fine meeting already, and looking forward to more. So I'm very pleased today to talk about promoting mental health of young people. We've just had a very interesting presentation from Dr. Kutcher about school mental health promotion, and this presentation will be taking a slightly different angle. But first and most important, I'd like to acknowledge my colleagues. And Professor Pat McGorry, who is Executive Director of Origin Youth Health Research Centre, Origin Research Youth Health, and other colleagues there. And what I'll be covering this morning in the next few minutes is thinking about 2 related but separate things. First is services for young people with mental ill health, and then about involving young people in promoting mental health. I'm sorry, I think this machine is working a little bit and not so much. I think you mentioned there was some problem with this. It's not working very well. Okay. Yes. Yep. Thank you. So next one, please. Next. Okay, so whether we're talking about mental health services or working in other ways to promote mental health, there is the question, as we've just heard as well, about treating and supporting people within their own communities, as well as valuing mental health in the communities. So thinking now about services for young people with mental ill health. Well, mental ill health is the major health problem for young people. And we have a paradox that despite this, access to services is more limited for young people than for other age groups in most places. And also the awareness of the needs of young people and advocacy for them tend to be quite fragmented. Now this is a schematic diagram based on the burden of disease studies, which shows us the reasons for our concern that the yellow parts of the diagram are the rates of incidence of mental disorders in concentrated in the early age groups, as we're well aware. Next. And thinking about the epidemiology of mental disorders, well, we've had a number of cohort studies, including the Smoky Mountains study in the USA, but one in New Zealand, which showed also that 50% of the young people in the study, in this cohort study, experienced at least one psychiatric disorder between 18 and 25 years of age. And we are also aware from a range of other studies that most disorders of adult years come on before the age of 24, and that the decade after the age of 15 is the peak age of onset of mental disorders of adult life, and that the major disease burden of young people is mental disorders, including substance use disorders. And these are important, obviously, because they interrupt pathways to taking part in family life, to getting a job, completing an education, and generally to economic participation. And most young people don't use healthcare very readily. They don't think of themselves as ill. They don't think of their emotional turmoil in the same way as they might think of having a head cold or a broken leg. And certainly in our community in Australia, and I think in many places, young people are less likely than people in other age groups to go to a family doctor or a general health practitioner, let alone to any specialist mental health service. And then related to the problems of mental ill health, but to other things as well, we have a major problem of suicidal behaviour in our community, and we're not alone. This is common in most countries. Suicide is the leading cause of death in young people in Australia, and the suicide rates in young men have trebled in recent years, and for us it's those living in rural and remote areas that are more likely to die from suicide than those in the cities. And young women in particular are quite a high proportion, up to 5% have report self-harming behaviour. And this is higher than in adults. And teenagers report up to, a high proportion of teenagers report thoughts of self-harm. Now, Michael Rutter and colleagues talked some time ago about the rising tide of psychosocial disorders in young people, and this paradox that for young people at least in the wealthy countries and in many countries, physical health is now better than at any previous time, and yet mental ill health is an increasing problem. And it's not just one disorder typically, it's a range of problems. It may be some symptoms of depression and anxiety, it may be harmful use of alcohol or perhaps cannabis or other drugs. And it may be delinquent behaviour, it may be dropping out of school, and suicidal behaviour, as we've mentioned. In our community, at least, there's been very high awareness and concern in the media and in community discussions. And there has been some funding devoted to youth mental health. However, how to make this effective is the next question. Before moving on to thinking about what we've done in Australia, just a thought about the definition of young people. I've put up a whole list there, which are definitions not for you to read in detail now, but to indicate that many organisations, national and international organisations, have thought about how to define young people. We use the definition of 12 to 25 years, and this is beyond the age group. It goes older than the age group of traditional child and adolescent mental health, if we think about mental health service development. And that's quite deliberate. There's no easy boundary between anything in life, but the boundary between traditional child and adolescent and adult mental health services tends to come at a very awkward time. It's right in the period of peak onset of mental disorders, and it marks a very big gap in service provision. And the World Bank's talked about the critical transitions for young people in this age group of 12 to 25, or approximately that age group, where they're in the midst of education in many places, they're in the midst of establishing a working life, health. There are many problems in mental health or substance abuse, as we've discussed. They're in the midst maybe of establishing a family or separating themselves from the family of origin and becoming useful citizens. And George Patton and other colleagues have talked about how physical and intellectual growth can outstrip the growth in maturity and psychosocial life, so that young people can be precocious in understanding intellectually, but their experience of life is, of course, not very long at that age. And we're aware of major structural and functional changes in the brain, many of which we've been hearing and will hear more about at this age. In essence, for us at least, the service system has been weakest where it needs to be strongest. So we've had a gap. Our adult mental health services pick up at the age of 17, and the child and adolescent services finish at the age of 16. And certainly when I was director of an adult mental health service, when we'd get a 17-year-old boy into our service, he would sometimes look very frightened and very lost. And that's, of course, because the adult mental health services are places where people who don't get better remain. This is data from our National Mental Health Survey, conducted 3 years ago. And the green lines, the lighter lines, are the service use from people of different age groups. So the young people are here on the left. These are the older age groups. This is the service use for the young people. And the blue lines are the reported prevalence of mental disorders. In this case, these are disorders diagnosed according to DSM-4. And this gap between reported prevalence of disorders and service use is greater in this young age group than in the older age groups, although it's present across the board. Now, this is in a country in Australia where we have a relatively well-organised health service and mental health service system, and compared with many other countries, it's well-resourced. Compared with our general health services, it's not well-resourced, but nonetheless, there is at least universal health insurance, and people can get access to mental health services free of cost when they need them. So this gap for young people is particularly worrying. And when we look at the those people who get access to care when they need it, the top line is the need for services in young men, and the blue person is the proportion who get access. For women, young women, the need is a little greater and the access a little greater, but the gap is very high. And this is a illustration of our current services throwing a life raft here in the bottom rather than strengthening the bridge across the top. You may have seen diagrams like this before. I think this one originates in Scandinavia. And when we think about young people, we think across healthcare about early intervention, about any age group. Early intervention is an established mode of action in healthcare. So the emphasis for us has been in early intervention in mental health care for some time now. So considering services for young people, they need access to services that are friendly to young people and services that reduce the disruption and the risk of developing chronic disabilities that assist in that transition. And also, the same thing is not relevant to everybody. We need to be services that suit the individual, suit their particular needs, and able to respond to these diverse needs. So the vision for youth mental health that our group has taken and is now part of the national agenda is that in 2020, young people in all communities will have access to the knowledge, skills and services necessary to respond and support them in periods of mental ill health. I'll come back later to a broader agenda relating to health promotion, but this is enough for a start. Now this is a slightly longer slide, and or at least a longer list of things written up here. But the reason for this is just to give you an overview of the thinking about how youth mental health services are placed. Now first up the top, we have improving the community capacity. So using various sectors like education and the arts. In our community, sports are very important to young people and to many, many people of all age groups. Also, e-health and self-care initiatives. This is the first way of thinking. How do we promote the value of mental health in these areas? Then we come to primary care services. General practitioners, so general physicians, teachers, school counsellors, community health workers and other youth workers. In a broad sense, these are all primary care workers. How do we enable them to assist young people in trouble? This group of enhanced primary care services is where some innovations have occurred that I'll describe a little further, the headspace services. Here there is a concept of general health practitioners working with specialist mental health service providers in a multidisciplinary service centre where young people can go in the community, in a shop front or a similar relatively free access environment. And then we have the specialist youth-specific mental health services. And that's where there can be comprehensive assessment and treatment and working with social and vocational recovery services for those that require that. So talking now about that group of enhanced primary care services as well as the specialist services. So here in that enhanced primary care or service, the term headspace I'll explain a little further in a moment. This is providing early intervention, particularly for the common mental disorders, for anxiety, depression and substance abuse. And in a setting where general health and sexual health services and vocational services are also provided. And the range of specialist mental health services that I've just referred to as well. They would be in a different setting, but there'd be interaction between these. So to talk for a moment then about Headspace, this is also the National Mental Health Youth Foundation. So the Australian government supported this foundation and began with 30 centres operating nationally. And it's got to the point now where there's been a new initiative announced for another set of headspace centres where communities have been competing and complaining when they didn't get an allocation for a youth mental health service. This in itself, I think, is something a bit new. And we expect there to be 90 sites open in the next couple of years. This is the website. So it's designed for the Headspace website, designed to be accessible and interesting to young people, and designed with the involvement of young people in taking their advice. And from this, the young person can find out where a Headspace centre is that's nearby to them. And this is the first set of Headspace centres around the country. And not many people live in the middle of the country, but this is Alice Springs, and this is up in the Kimberley. I think somebody said they had a sister living somewhere up there that way. This is Darwin up in the north. So the tropical areas up here. But the main population centres are on the southeast coast. And many of these centres are in areas of relative socio-economic disadvantage in the cities, and a number in the relative, some of the new batches are in these more remote rural areas. So the idea is, with this new approach to services for young people, to bridge a number of gaps. The first gap is between general health care and specialist mental health services. Young people, as I mentioned, tend not to go to our general health services. They tend to be seen as family services or older people's services. But these enhanced primary care services attract young people who can then be referred as needed to specialist services, or even the psychiatrists will come into these enhanced primary care environments, as will the drug and alcohol workers. It's also bridging the gap that I mentioned between adult and child mental health and healthcare systems, and also that big gap that most of us experience between mental health and alcohol and drug services. It's designed to attract all young people in the age group of 12 to 25, and particularly those that have need of early intervention and help seeking. It's affordable, and in that it operates through the health insurance systems. It uses existing resources. So what these systems do is establish a centre, a gathering point. So it needs some premises, so there is some capital involvement. It also needs a manager and maybe one or two staff, but otherwise the other service providers are visiting and usually are funded through their own funding streams, through insurance or government or other funding. And important features are the involvement of young people in the design and operation of these services, in taking their advice and consultation, and involving families in ways that respect the wishes of families as well as young people. And what do the services include? Well, the idea is to attract young people, not put up a label saying, come here when you have a mental health disorder, a mental disorder, but they're designed as youth health centres that young people feel free without stigma to visit. So they cover general health. There are general practitioners from neighbouring services that come and stay there. They provide mental health and counselling services, alcohol and drug services, but also for those young people who are seeking help with education, employment and other things. And each Headspace centre has a committee of its own board, advisory committee, and that board will work with the local community to determine what other services are needed. And these might include services for sexual health or homeless youth or Indigenous health services, particularly in the rural areas. And they also link up with school-based programs and with, there's an e-Headspace. So here are some images from Headspace. This is one in the west of Melbourne, which is a former industrial part of the city and now tends to be more socio-economically deprived. This is an old factory that's been renovated to contain these premises, and it's quite a striking building. In the centre, that's our Prime Minister, Julia Gillard. That's Pat McGorry. And this is we have a minister, National Minister for Mental Health, as well as a State Minister. It's our current Minister for Mental Health. This is at the opening of one of the Headspace centres. Here's another one that's up in the south of Queensland, which has a shop front. And these are some of the young people in the centre. And the features of Headspace, well, youth participation, family support, home-based treatment, so the young people can receive services at home they need, recovery programs. Okay, so now a brief look at some of the other work on promoting mental health. I won't dwell on the definition of mental health, but just to mention that it's more than the absence of disease and a state of well-being and a set of capacities. And interventions that aim to influence the social determinants of health, particularly social connections, being free from discrimination and violence, and participating in the community. And we've heard about very well about the setting of school-based mental health promotion. I wanted to mention briefly some of the work in information communication technology, and through that as well to understand the best ways to engage government and corporations and the not-for-profit sector in promoting mental health. Next. So youth participation is central to this, empowering young people to be part of it, to engage them, and to ensure that all young people, not just those who are keen and put up their hands first, but people from immigrant communities, from Indigenous communities, those that are socio-economically disadvantaged, and those with disabilities. The Inspire Foundation is a not-for-profit organisation that's been established now for about 15 years with the work of an outstanding social entrepreneur named Jack Heath, who also set this a similar foundation up in the US more recently and in Ireland. And it aims to use technology to improve the mental health of young people. It began as a suicide prevention program, and the two features are the use of technology and the engagement of young people. And it uses the internet. And Reach Out is one of its key programs. It's an internet, a web-based service, a coordinated system with information, support and resources. So here is the website. It's that's slightly out of date picture, but you're welcome to visit, of course, and see it, reachout.com. And just to emphasise the point that youth participation is seen by their founders and workers in this foundation, as well as the young people themselves, as providing the flesh and the organs to this enterprise. Building on that and supported by that, there's a cooperative research centre called Young and Well. And cooperative research centres are Australian government initiatives that have mainly been set up to work in commercial areas, but have in the last couple of years been involved in social justice work. And this is one of the first centres of that type, and the first one to be established through a not-for-profit organisation. Has 60 supporting participants and a group of essential participants, so-called, that include Origin Youth Health Research Centre and a number of other universities and workers. And this is an organisation that includes not-for-profit, academic, government and corporate partners that unites young people with all of these groups and investigates the use of technology in young people's lives. Predominantly how to improve the mental health of young people, but also concerned with cyber safety. Next, please. And so this is the government department, the National Department of Industry, Innovation, Science, and so, etc. Working in partnership with young people through a Youth Brains Trust, and this helps to set the strategic direction with a number of important values that include being connected and creative as well as safe. Next one, please. And the programs of research, there are 3 of them. The first one is related to young people altogether, so universal programs to provide tools for young people to promote their mental health, also to their parents and to their teachers and others, professional groups supporting them. Then young people vulnerable to mental ill health through disability or through being part of a minority or disadvantaged group, and young people experiencing mental health difficulties, so the more fundamental e-health, as we might think about it, which might complement the direct service provision, and investigating the role of technology in people's lives, as well as safety, thinking about how to improve mental health on the basis that young people spend a lot of their lives now in front of their screens, whether on mobile devices or on computers and laptops, as well as in school. So these are some of the research programs which I've really referred to, training programs, online services and resources. And I'll conclude by saying that we've been concerned with treating mental disorders and preventing suicide and promoting mental health, that these need innovative thinking and partnership, thinking about awareness, about how to engage young people, and how to use the evidence and experience and to evaluate the programs, and how to use the new ways that young people live and that all of us are living as well. Thank you.
Thank you very much for your wonderful talk, Dr. Herrman. We have time for 1 or 2 questions from the audience.
Here. May I? Thank you very much for this wonderful talk. I think it's fair to say that the situation you described in Australia, for many of us interested in providing care for children and reaching out, is a dream come true. Having a Ministry of Mental Health is also something quite at the realm of dreams in many parts of the world. So my concern as a researcher in the field of child development and provision of services is what are your ideas about how we can most efficiently generate the evidence so that this type of experience can be exported or can be disseminated and scaled up for other contexts? How can we generate this type of evidence? So.
Yes, thank you very much for the question. Some of our work with the WHO Collaborating Centre is in fact concerned with this. Is this something that can be done just in wealthy places, or is it in fact a way of allowing some contact with services and with mental health promotion in parts of the world where there is nothing. As we know that in most places, most countries of the world don't have any policy related to mental health of young people and children. And in many countries there are very few child psychiatrists. I think in one of the sessions yesterday, Dr. Helen Herrman told us that there were 3 child psychiatrists for 167 million people in Bangladesh. So I think whether it's China, Bangladesh, many other countries, we have very little provision in specialist services, and also our general health services are not well equipped to deal with mental health, but particularly with the mental health of young people. This, of course, being the paradox. That's where the need is. So the hope is that this kind of thinking might also strike a chord, that it's not that we need to create a whole new cadre of workers, but through enhanced primary care services, it may be possible to interest governments, to interest communities in thinking of ways to use their existing resources a little differently, as well as to involve the young people in helping to create that.
Anybody else? Okay. Thank you very much.